Welcome to today's press briefing. We have with us from the CHP Communicable Disease branch of the CHP Principal Medical and Health Officer Dr. Albert Au, and from the HA Chief Manager Dr. Larry Lee. We will first hear from Dr. Au. Good afternoon, everyone. I would like to report to you new cases reported. Total number is 34,466 cases. Of the 34,466 new cases, there are 3,588 cases picked up by the HA and 2,391 picked up by Public Service Laboratory of the CHP. The remaining 28,487 cases are picked up by private labs. Case number is 171321220578. Of the 34,000 plus cases, 4 of them are imported cases. The remaining 34,462 cases are local cases. This is another record high of a single day of number of reported cases. Starting from the 31st of December last year, that is the start of the 5th wave, the total number of confirmed cases stands at 193,149 cases. We can see the rate of increase and the trend is large and high. Once every 3 days, the case number will double. Say, for example, between the 21st and the 22nd of February, we have about an average of 8,000. But between 23rd and 25th of this month, the number of cases has increased to about 17,000. Yesterday was once again 100% higher, that is 34,000. We think that the number will continue to climb. When it comes to genome sequencing analysis of the cases picked up yesterday, Public Service Laboratory has tested 2,391 cases on genome sequencing. 3 of them carries L452R. That means they are Delta variant. That accounts for about 0.13%. 1,902 cases are negative to L452R. That means they are Omicron cases. That accounts for the majority. That is 79.6%. 315 cases are still pending the result, and 171 samples cannot be determined because of the viral load. Now I move on to outbreaks in residential care homes. Yesterday, we have recorded another 49 care homes with positive cases or outbreaks. 3 on Hong Kong Island, 32 in Kowloon, NT East 1, NT West 13 care homes. Most of these care homes are care homes for elderly people, 43 of them altogether. 6 cases involve care homes for persons with disability. Of the 49 care homes, we're talking about 430 residents and 62 staff members. In the 5th outbreak, the total number of care homes stands at 580 of them. There are about 2,900 residents involved and about 865 staff members. Number of death cases, according to the latest information of the HA, it stands at 636 cases in the 5th wave. For 442 cases, we have conducted certain investigations. In the 442 cases that we have conducted an investigation, there are 268 males and 175 female. Age ranges are 11 months to 104 years old. The median age is 84. The majority of these fatality cases involve elderly people. Those above the age of 60 account for 92%. In relation to age groups, 4 are between the age of 0 and 9. In this age group, the fatality rate is 0.04%. 2 cases involves children aged between 10 and 19. Fatality rate is 0.03%. Between 20 and 59 years old, there are 29 death cases. Those between 60 and 69 years old, 35 deaths. So the death rate has increased to 0.17%. Between the age of 70 and 79, there are 80 cases. The fatality rate is 0.87%. Those above the age of 80 accounts for majority of the death cases. Altogether, 292 cases, standing for about 66%. In this age group, the fatality rate has increased to 4.6%. Looking at the vaccination record, 91% of the cases have yet to complete a full course of COVID vaccination. 403 cases have yet to complete the vaccination course. 359 cases have not even received the first dose, which is about 81%. Of those who have been vaccinated, compared to those who have not been vaccinated, for those who have received at least 2 doses, the fatality rate is 0.03% of the whole population. Those who have not completed a full course of vaccination, the fatality rate is 0.27%. That is a marked difference in terms of increase. Those above the age of 80, in these cases, those who have received at least 2 doses, the fatality rate is 0.27%. Those who have not completed the course of vaccination, the fatality rate is 4.34%. So a difference of 16 times. So the death rate will be reduced by 93% between those who are vaccinated and those who have not. So please get vaccinated as soon as possible. Because from the figure and the data, we can see that there is a very significant difference between rates of survival. For elderly people, if they contract COVID, the fatality rate is over 4% in the 5th wave. Those who have been vaccinated, the death rate is at a low level. That's all for my report. We'll now hear from Dr. Lee about the HA. There are 5,882 cases that are confirmed and preliminary positive. They're staying at the different hospitals, the AWE community treatment facilities, North Dental Hospital Infection Control Center, and the Infectious Disease Center of the HA. 402 people are staying at Penny's Bay Community Isolation Facilities. 49 cases are in a critical condition, 66 in a serious condition. As at midnight last night, in the previous 24 hours, there are 87 patients who have passed away. They are between the age of 51 and 100. 59 males and 28 females. Of the death cases, 49 came from care homes, and 87 of the 87 people, 67 of them have not been vaccinated. 10 have received 1 dose, 10 received 2 doses.
And there are 79 who are over the age of 65. As for those who die at a younger age, we have number 70, a male of 58 years old. Number 74, a male of 51 years old, and a number 102, a female of 52 years old. For the male aged 58, in the PM of 25th of February, he went to the A&E Department of Characters, and because of fever and shortness of breath, we gave him resuscitation, and he was hospitalized. He was institutionalized originally, and in the morning of the 27th, he passed away. For the male aged 51, on the 21st of February, he went to the A&E department of Characters Hospital, and he was intubated and was admitted into ICU. He had chronic illnesses. And in the morning of the 27th, he passed away. And the third one, the female, aged 52, on the 23rd of February, he went to United Christian Hospital A&E department because of dizziness and vomiting. And there was brain hemorrhage. And she was also hospitalized. And in the afternoon of yesterday, she passed away. We could see from these three cases that all had other or chronic illnesses. And because of a backlog in figures, we'd like to report 37 deaths from the 19th of February to the 25th, including 23 males and 14 females, and aged 37 to 105. Altogether, 841 patients died in public hospitals over the past 2 years. In the past day, 690 patients were discharged, and 88.4% of our isolation rooms have been used, and that is already our upper limit. And over 70 patients were screened positive upon admission screening. And as for our staff, 3,160 staff members have been confirmed positive. Tomorrow, the HA will activate 5 more designated clinics, and they are at Madam Peel General Outpatient Clinic, the Jockey Club GOPC, and also Chang Kwan On Polling Road, and also another one in Fanling. So altogether, there would be 14 designated clinics which will be up and running. These will serve people who have been tested positive, who are waiting to be hospitalized or to enter into an isolation facility. Until the 27th, there has been a total of 13,000 consultations at designated clinics. I'd like to remind patients that they have to make a booking by phone so they do not gather at the venues. And also the press release that we will be giving out later will give you details. Now it is the time for questions. Please raise your hand and use a microphone, and also introduce your organization before asking a question. The lady in the front. Good afternoon. I'm from TVB. First, Professor Sylvia Chan said this morning that because there is insufficient space at the mortuaries, there is the placing of dead bodies in the hospitals, and she says that she would be increasing the capacity at mortuaries. I would like to ask about the hospital mortuaries at the HA and also public mortuaries managed by the Department of Health. What kind of increase in capacity do you expect to see? When there is such a tight supply of mortuary space, are you sure you can do something about this? And secondly, I would like to ask you about your assessment of the epidemic. Just now, the Secretary of Education said that before the 17th of March, students will start their summer holidays. Is it that the universal testing will not be earlier than the 17th of March? Because we are now already at this state of the epidemic. Do you think that universal testing will still be effective if it starts after the middle of March? And even if you can detect many people who are positive, what can you do about it? And number 3, every evening when you release your press release, if we minus the reported positive cases released at the press conference from the confirmed cases in the press release, there is always a difference up in the region of thousands. We asked the Department of Health, and you said that the 30,000 odd additions were reported by private labs. I'd like to ask, why is it that at the press conference you do not include that sum? The Department of Health says there is a backlog, and therefore you do not report this at the press conference every day. Is it that the number is even bigger than what we think it is? Is it that because of this, the public are not fully informed of the severity of the epidemic? And also, I'd like to ask you, what is your backlog? How serious is the backlog? And also, at the temporary hospital in Chengyi, it is reported that the people there have to share the use of toilets. Do you think it is ideal? Okay, first of all, I will talk about the handling of dead bodies. In the past 2 weeks, given the very cold weather, usually we would have a surge in deaths. And because of the epidemic, the mortuaries at the public hospitals are already at capacity. And also because of the legal procedures involved for the transfer of dead bodies to public mortuaries, there is some delay, and therefore there is pressure. Together with the FEHD, they said that they would increase manpower in order to transfer the dead bodies. And the HA has talked to our different stakeholders, including the bereaved families, the
處理呢個問題嘅。
我想問一條，咁可唔可以制定一個措施，譬如話過咗幾多日就要或者幾個星期個遺體需要被認領，咁就可以騰出翻啲空位出嚟俾一啲新嘅遺體佢哋即係放。
都多謝你問題，咁我哋諗緊一啲方案嘅，短期內係希望可以加速，可以增加呢個儲存遺體嘅空間。
多謝你嘅問題。咁我補充翻咧，其實喺現時嚟講咧，喺衛生署咧轄下咧係有3間嘅公眾殮房，包括富山公眾殮房啦、葵涌公眾殮房同埋域多利公眾殮房，共提供係506個固定嘅遺體儲存空間。咁喺2021新冠病毒大流行期間咧，其實公眾殮房嘅遺體儲存空間咧已經係即係逐步增加到去大概現時係1350個。咁其實衛生署係一直係有監測公眾殮房嘅
1,350, and we have been monitoring the use of public mortuaries. We know that in the past 2 weeks there has been an increase in the number of dead bodies stored, and the capacity is already up to 90%. Since there is such a tight supply at present, the D of H together with the FEHD are talking about emergency response measures. And of course, we are working very closely with the HA. As for the state of the epidemic, from the figures, we can see that this is still a rising trend, and the situation is worrying. Within 2-3 days, the figure can be doubled. So we believe that in the short period to come, the figures will still be at a high level or even increase further. And the government is working doubly hard to increase the number of tests that can be done, because we like to have early detection, early treatment, and early isolation, so that asymptomatic cases can be detected in the community, because we need to identify these cases before we can allow patients to know that they have been infected and should stay at home and not be in contact with anybody, so they can go for home quarantine and isolation, and so that the family members should also be detected and also tested.
We try to contain the scale of transmission and to keep the cases number down. The government is going to launch universal testing, which is a sizable operation. They need the coordination and cooperation of different departments. preparation work is being conducted at full steam. Facilities will be increased and testing capacities will be expanded correspondingly. We need more testing, and when more confirmed cases are picked up, we need sufficient facilities for isolation. And those who do not need hospital admission, they may be isolated at home. And their family members may also be isolated in a home setting. Everything is being prepared for. That's all the information I have. In relation to the lag, we have changed the confirmation criteria. Previously, there were two figures. One is a preliminary positive case. They are mainly cases picked up by private labs as well as the hospital authority. The samples will be sent to public health laboratory for verification. The confirmed cases we announce every day are those checked by public health laboratories. They may be cases coming from the HA or private labs the day before or 2 days before. Starting from Saturday last, for positive cases picked up by private laboratories, they will now be deemed as confirmed cases without a verification by public health laboratory. We put that in place since Saturday last week. On that day, we have already received preliminary positive cases sent to us by private labs. Previously, they would be double-checked by public health laboratories before they are deemed as confirmed cases. So in the past, it would take 1 or 2 days for them to become confirmed cases from preliminary positive. So the cases that we received as preliminary positive on Saturday, we turned them into confirmed cases starting from Saturday. And the day when they become confirmed are the days when the reports were made. That's why that you see some more cases. That's the difference between cases that have been reported to us. But because of the change of reporting criteria, these will become confirmation instantly. But they were reported to us before that day. So, what is the backlog that have yet to become confirmed cases? We have caught up already because those cases are now confirmed cases. That's so. Nowadays, when we give you the number of confirmed cases, that will be consistent with preliminary because all reported cases are confirmed cases. I'm from Now TV. I'd like to ask. Today, the Secretary for Food and Health said that she doesn't rule the possibility of a citywide lockdown with the universal testing. Will the implementation be expedited? And some experts said that that should have been done at the start of an outbreak, and without sufficient isolation facilities, it's a wasted effort. Well, now we have a full outbreak. Does it mean that universal testing will not be as effective? Yesterday, we learned that notification has been put on hold from the Leave Home Safe app. So under what circumstance will people receive notification? Without notification, what's the use of the app itself? Thank you. In relation to universal testing, as I said, that relevant government departments are working on preparation before the launch. I believe that during the period of universal testing, we think that the government would ask people to stay at home because if they go out, there may be positive cases that are walking about in the community, which will dampen the effectiveness of universal testing. We believe that there will be measures put in place by the government. These measures may involve asking people to stay at home. Whether it is done by way of legislation or any other ways, we will have to wait and see. For universal testing, the objective is to pick up cases. If it's done at the start of an outbreak, it will stop the spread of the virus sooner. But there is no clear definition as to when is the best time to do it, or whether it is useless if it's done in the middle of it or at a late stage. By screening, we are still able to identify positive cases or hidden cases. And when these cases are picked up, there will be measures put in place to stop further transmission. If need be, these people will be sent to isolation hospitals, community isolation facilities, etc. If these facilities cannot meet demand, then people with mild symptoms or without any need for admission, we may ask them to be isolated at home. Well, basically, everyone has to be tested under that scheme, and confirmed cases and their family members will have to stay at home. In relation to the Leave Home Safe app, there are numerous hidden transmissions. In recent cases, we ask people to use an online platform to give us information about their address and the occupation. We find that there are many cases in many different locations. So, well, our advice is that staff members of shops and restaurants or companies should stay at home and not go to work, and they should get tested and not return to work until they get a negative result. So currently, well, going to get tested only when you receive the notification from the app may not be as effective, because you might receive numerous notifications every single day. So we can't possibly ask everyone to get tested every day. The purpose of the Leave Home Safe app is that when everyone's used to using the app, we can conduct analysis and tracing of the history of the whereabouts of confirmed cases. The gentleman in gray. I'm from AM 730. I would like to ask about the RAT rapid antigen test platform. You said it will be launched soon. But if one has used RAT and is positive, but the RAT kit itself is not recognized, do they have to go out to get tested? Would there be transmission risk? Previously, you said that you have suspended non-essential services of hospitals to release manpower. How many staff members have been released to work at A&Es as a result? How many beds and designated clinics? What is the daily capacity? You also mentioned on the list about a drug dispensing clinic. What are they? And these dispensary is not available at every designated clinic. And you said that there are 37 cases of deaths, and some of them are below the age of 65. What about the one who is 37? The 37-year-old case is someone who suffered from chronic illnesses and staying in a care home, and that person's in need of care long term. It's a shortness of breath and fever. He was sent to a Kwong Wai hospital. He was discharged on the 25th, but the situation changed, and he was sent back to the Kwong Wai hospital on the 26th and then later died.
You mentioned hospital beds. I do not have any data to show how many staff members have been released because of the stoppage of non-emergency services, but I can tell you everybody is on standby. Apart from negative pressure beds, we have converted certain beds to the service of confirmed patients. And actually, patients are also in our community treatment and isolation facilities. You know that over 3,000 HA staff members have been confirmed positive, and therefore other people have to help out when they are on sick leave. As for the medication refill clinic, this is to replace the need for people to come to GOP clinics. When patients come, we will allow them to get medication at hospitals or outside. But I need to give you the details only later. You asked about designated clinics. What's your question, please? Are the capacity at the new ones? I don't have the figures here. Let me give you the answer in writing later. As for the RAT online platform, we would ask the public to do RAT or PCR test. Of course, PCR test is the more accurate version. If you can arrange for a PCR test, that's very good. If not, the RAT can take its place. But then you must purchase RAT test kits that are up to standard, or else there may be false positive results. Whether the test kits are up to standard, I would propose that members of the public would only go to reputable stores to buy these test kits. And if there is any doubt, please check the test kit you are using at our online platform to see whether the test kit you are using is up to standard. And if it is, then the test result can be trusted. And if you are tested positive, please stay at home, and your family members should also get tested. We are working at full steam to construct a platform for people tested positive to report their cases. This will be deemed as confirmed cases, and we will issue a compulsory or quarantine order to them, and their family members will also have to be tested. So please be careful. Use a test kit that is up to standard, and if the result is positive, please report to us at the online platform when it is up and running. Sorry, the question did not come through. Members of the public should ensure that the test kit is recognized and up to standard, because we would not know what brands the people are using. If there is a report of a positive case, then we will treat it as a positive case. The lady in beige top. I'm from Phoenix TV. Today, a third batch of mainland experts have come to Hong Kong. I'd like to know what kind of special duties will they take up, and how will Hong Kong work with them? It is said that about 9,000 sample-taking personnel will come to Hong Kong from the mainland. When will they arrive? Is it that in March, universal testing will start? And then is it that before universal testing, the 9,000-strong sample-taking fleet will come to Hong Kong? I'd like to ask whether medical staff from the mainland will also come to Hong Kong. There are 4 temporary hospitals to be set up in Hong Kong. The one at Tsing Yi will be completed today. Is it that the medical staff who have come from the mainland can immediately work at the Tsing Yi temporary hospital? When do you expect the Tsing Yi temporary hospital to take in patients? And also, just now, Dr. Ao said that the use of test kits and also the dead bodies to be handled. As you said, there are only 3 public mortuaries. Will you, for example, consider setting up temporary morgues to store the dead bodies in the interim? Thank you for your questions. Sorry, I have to answer you in Cantonese. As for mainland staff who are coming to Hong Kong to help, the Hong Kong SAR has been receiving so much help from the central authorities. They have given us a lot of support indeed. I understand that since we are going to do universal testing, you can imagine that we will not have enough people in Hong Kong to test all the people in a short period, and we must need the support of the central authorities. And therefore, I understand that there will be sample testing people from the mainland coming to Hong Kong to help. We are also constructing more hospitals and isolation facilities because we expect to see a huge increase of positive cases, and we must have enough facilities for isolation and treatment. The preparation work and also the construction are going on at full steam. I understand that very soon temporary hospitals will be completed and they will start providing service very soon. As for hospital staff or medical staff, I defer to Dr. Lam. Dr. Lee, you mentioned the temporary hospitals. Usually we call them community treatment facilities. Right now at the Asia World Expo, we already have 1,000 beds there, and our medical staff are operating it. There are 20 doctors and 100 nurses. And the facility will treat people with mild symptoms and also people who already have other illnesses. As for those who may not have symptoms, they will stay in community isolation facilities. Well, we do have a need for community treatment facility, especially when there are more patients, and also the elderly may need such facility. As you know, we have a tight supply of medical staff and hospitals are under pressure. So if we have more temporary hospitals, we will be greatly helped. As for public mortuaries, since we have more death cases because of the cold weather and also because of the coronavirus spread, when patients die at A&E hospitals, the dead bodies have to be sent to a public mortuary for a coroner's inquest. But you know, the transfer of dead bodies now is now a problem because we do not have enough personnel to do it. And therefore, we are talking to the funeral operators, DH, FEHD, and also the bereaved families. And in fact, the departments are already doing their best to quicken the transfer of dead bodies. Next question.
Good afternoon from the South China Morning Post. First of all, can we get an update on the capacity of the 3 public morgues? And can you provide details about the planned use of freezer containers for dead bodies? So how many are being ordered and when will it be used, etc.? And were health authorities unprepared for the number of deaths that we're currently seeing before, hence the backlog currently? Second is, of the 120,000 cases registered with the platform set up for positive cases earlier, only 56,000 seem to be on the positive case list, and the rest were believed to be rapid test positive. So what happened with the other 60,000 plus cases? Are they classified as newly reported already, or are they not reflected in the overall tally yet and need to be reconfirmed? Will the Leave Home Safe app stop sending out notifications for all premises like shopping malls and grocery stores, or is it just restaurants for now? And I'd just like to clarify if the 34,000 plus cases confirmed today include rapid test positives. If not, does that mean we have more cases unaccounted for? Thank you.
Okay. Regarding, I think you're talking about the isolation bed capacity. Actually, our usage is around 90% or the 88.4%, which is very close to the threshold we do. And actually, we have around 6,000 patients staying in our HA premises, including the HKICC, the Community Treatment Center in Asia World Expo. For the mortuary, I think this is a very special situation. We have a traumatic pressures on the capacity of our mortuary capacity for the corpse. We are doing our best, and actually in HA we have more than 3,000, and the situation is we have some gridlock in transferring of the corpses from the emergency department to the public mortuary, and this is the bottleneck that we are working very hard on.
For the rapid antigen test, currently the government has announced that rapid antigen tests will be regarded as confirmed cases. So the Department of Health will launch an online platform for persons tested positive by rapid antigen test to report the information and also the information on the household contacts and also demographic data to us and we will issue quarantine order and also isolation order for them. Regarding yesterday, I have mentioned that there were about 120,000 persons submitted information through our newly launched communicable disease public interface. Among these 120,000 persons, we have matched that about 56,000 confirmed cases with PCR positive, but however, for the remaining cases, some of them had indicated in the remark that they are tested positive by rapid antigen test, while for others, we do not have any information regarding their tests done. We suspected that a majority of these so-called unmatched cases are tested positive for our RAT. So we will send SMS to them to inform that if they were tested positive for RAT, then they need to observe the preventive measures as a confirmed cases. And also in the near future, when the formal online platform for reporting of RAT positive cases is launched, we will send SMS to request them to submit the information, and also we will verify their identity so that we can count them as confirmed cases.
下一位嗰邊後邊嗰位女士。
Sorry, can we clarify if the leap from safe app still sends out notifications?
At this current moment, the government do not send out a message through the Live Home Safe. Previously, we have done that because we want to, previously when there were few cases, it is very important for the populations to get notification that they have been to a places where there was a case. But however, in the current situation, when the cases is so prevalent in the community, so it is expected that there will be cases everywhere. So it is the notifications will not serve the purpose of notifying persons that he or she had been to places where there were cases, because there's so many cases in the community. So we stopped issuing the notifications while the Live Home Safe at the current moment.
嗰位女士。
Thank you, doctors. I'm from Bloomberg News. My first question is about, I guess, the CHP and the government's stance on dynamic zero COVID. We've seen basically the rules for positive cases can, self-isolate at home, and the period of which they need to stay at home before a negative test has also reduced. We've also seen Leave Home Safe app no longer notifying people who have been to positive cases that have also visited. So is it still the government's policy to maintain a dynamic zero COVID approach to fighting this pandemic? My second question is about the high number of deaths we've seen in recent days. The University of Hong Kong researchers have predicted in their study that at the height of this Omicron wave in March, the number of deaths could reach something like 130 or 140. So it seems like we are actually the pandemic is developing faster than what the Hong Kong University researchers have modeled. So how does the CHP prepare to, handle these oncoming number of deaths? And given that we've seen a lot of very tragic sights in the hospitals these days. And my last question is to just follow up on the children's deaths from related to COVID in recent weeks. I think the first case of the 3 or 4-year-old who have died has been with the coroner for several weeks now. Has there been any updates on that investigation? Thank you.
Thank you for your questions. First of all, for the prevention and control strategy in Hong Kong for COVID-19, the government adopts the dynamic zero COVID strategy. We aim to identify cases early and also put them under isolation and also provide treatment to them, as well as carrying out quarantine and containment measures, including home quarantine, as well as isolating the patients in community isolation facilities or hospitals as far as practicable. So this strategy will carry on. At the present moment, we aim to enhance our testing capacity so that more and more cases can be identified. If the majority of populations get tested, then we will pick up the cases and then implement the necessary control measures. For the deaths, maybe Dr. Lee can supplement.
Okay, I think I talked about the children death, the child death. I don't have any update, but among all the confirmed kids in the hospital, the number is around 400. And actually, none of them belongs to the critical and also the serious groups. And I think I would like to supplement something about the mortuary. We anticipate there will be an increasing number of the death. And short term, we identify the bottleneck is namely the transfer. But after that, we also think the overall capacity should be increased. So that's why we have to work with various stakeholders and try to make sure some other solution can be worked out.
Next, gentleman in Navy. I'm from Hong Kong 01. I have a number of questions. First of all, in relation to the compulsory universal testing. The government said 3 times over 3 weeks. Professor Sophia Chen said that citywide lockdown might be considered. And Dr. Au also just now mentioned about the restrictions of one's movements. Does it mean that it will cover the 3-week period? Or one can leave their home on certain conditions in order not to dampen the effectiveness of the universal testing?
Secondly, I'd like to ask about dead bodies. Some funeral parlors said that they were afraid of transmission risks. that if they are in touch with the dead bodies, then they may get infected, and that there would not therefore be makeup services for the dead bodies. I'd like to know whether there is indeed any risk when one gets into contact with dead bodies. And number 3, designated clinics. Actually, people have told us that they cannot get through when they call the telephone numbers, and even the designated taxi fleet may not be meeting demand. So don't you have also look at these complementary services? You are adding to the number of designated clinics. Are you adding manpower also to provide complementary service? And also, the public service laboratory have only come up with a few thousand positive cases, which is a huge decrease from before. Now you are not going to reconfirm cases, but you are reporting such a low figure. Is it because of a lowering in capacity, or what reason? Thank you for your questions. About universal testing, we are actually working very hard to prepare for it. We hope that within a short period of time, we will arrange for everybody in Hong Kong to be tested. We are not talking about a few weeks, because that will be too long. We have taken reference from the mainland experience, and we like to do this within a short period of time, that everybody will be tested and that we'll be able to detect all positive cases. Of course, we may not be able to do that just by testing people once. Maybe a few times will be needed. But as to the actual operation, we are still discussing it. But I believe we may do it, say, for example, for a few consecutive days, so we can screen everybody in Hong Kong. And detected cases have to be isolated at home, but if they have the need, they will be hospitalized, or they will be sent to community treatment facilities. But if they have mild symptoms, but still their living environment is suitable for home quarantine, and also if there are high-risk factors, then they will be sent to community isolation facilities. The family members will have to stay at home. As for other people who are tested negative, they will still have to go through a few tests. So we hope that people will not take non-essential travel outside their home. And over a period of time, of course, people may need to see a doctor or buy food, or for other reasons they need to go out. I'm sure the government will put in arrangements and also to provide for exemptions. And then there are people who have to keep the society going, like the police, the people involved in the operation, medical staff, and people who are fighting the epidemic. I'm sure they will be given exemption because they will have to make sure that society continues to function. As for the lockdown, and there will be exemptions, and will provide for special circumstances. When we have the entire plan, we'll announce it to the public. As for the public health laboratory and the positive cases detected by them, there are 2,391 cases that were confirmed by the public health lab. Of course, they have tested more samples, but it's just that we have changed the criteria for confirmation. When the specimens are tested positive for the first time, they will be sent to the public health laboratory. So we confirmed that for the first time, and the number is 2,391. But the HA and private labs now do not have to send their specimens for reconfirmation to the public health laboratory, but still we'll be receiving these specimens, and we are going to do gene sequencing. However, if there are death cases and serious cases of children, we have requested the HA to provide the specimens for us to do further analysis, not for reconfirmation, but for gene sequencing. And those numbers will not be reflected in the number of confirmed cases released every day. Dr. Lee, you talked about a hotline. Which one? Okay. There is a huge demand for services of the designated clinics. We started with 5, then 9, now we have 14. And the operation is getting on and becoming smooth, and we are increasing manpower to handle the hotline inquiries. Now that we have 14 designated clinics and we need to take more bookings, I'm sure the situation will improve. The gentleman in the 4th row, I'm from Ming Pao. Good afternoon. I'd like to ask about the online platform for confirmed cases. We have heard from a patient that he registered himself for 4 days, but he was not contacted and not given any assistance. I'd like to ask about the people who have reported themselves on the hotline. How many of you have you not contacted? And also the reported positive cases. When are you going to provide that online platform? And also now you regard RAT result as confirmation of positive cases. Are you applying that definition now, or are you going to wait when the online platform is up and running? And also, if there are now RAT positive cases, do people have to report after the online platform is up and running? How does he count the number of isolation days? Does he count from the day of the result or the day he reports himself on the online platform? And also, you reported to us 3 death cases about people who are relatively younger. You said that they had chronic illnesses. What are those illnesses, and were they tested positive before being hospitalized? And of course, they were severe cases when they were hospitalized. Does it mean that they became a severe case while they waited for hospital admission? And is it that the elderly are showing symptoms of pneumonia? And are you seeing more serious cases among the elderly? Is it that the elderly who show signs of pneumonia have not been vaccinated, or they were vaccinated with the coronavac vaccine? As for the 2 males who were aged 58 and 51, they had chronic illnesses, but I don't think I should divulge too much information about the patients. I suffice it to say that they were not entirely healthy to start with. And about hospitalization, actually they were detected during admission screening. And then the 3rd one, the female aged 52, upon hospitalization, she had dizziness and vomiting. We did a scanning, and she had brain hemorrhage. And then at admission screening, she was also screened to be positive. I think that's all the information. And then about elderly people, I didn't analyze the elderly cases that way. But as I said, 49 deaths were from care homes. And among the 87 cases who died, 67 did not reveal a record of vaccination. 10 had 2 jabs, 10 had 1 jab. As for the infectious disease public platform, this was launched last week. It was a new platform because we had a backlog of cases, and therefore we like to set up this platform so the public can proactively provide information to us, including occupation, workplace, address, and also family contacts. When we receive cases at the platform, we will contrast those with the list of confirmed cases. We use the identity card numbers to do the contrasting. And if we can see any case that match, then from the PCR test, we will know that it is a confirmed case, and we will arrange for government officials to provide information and RAT kits to them at their address for the patients and also their family contacts. But then there is such a big number of cases, so there is a lag in time. I know members of the public have to wait a few days and even so, some of them did not receive any information. I'd like to say sorry to these people who reported to us. We will work with other government departments to see how we can provide the information and related documents and assistance to the people who are confirmed positive. If you receive an SMS to say that you have been tested positive at a PCR test and you have reported to us, please stay at home and wait for us to contact you. And the day that the sample was taken would be the first day, regarded as the first day, and on the 6th day and 7th day, they have to do an RAT test, and if it is negative, then they can leave home and live normally. And the family contacts can be tested on the 6th day and 7th day when they get the test kit. And if it is negative, then even family members can complete their quarantine, and we will be sending a certification to these cases and their family members.
As to why some people have not received our kits yet, well, if we can't match their personal information, say for example ID card, we won't be able to identify them. But if they have not received our kits, then they should check their information entered on the interface to see if the information is correct. But it was only the day before yesterday that the FHB announced that RAT can be treated as valid in the determination of positive cases. But currently, we still treat them, we do treat them as confirmed cases, but we don't have the platform yet. I believe that the platform can be launched within this week. Once it is launched, then those who have done RAT without any PCR, they can make use of the new platform to submit information to us. We will issue them with certificates as well as send them to send them information and test kits. The announcement has already been made, so in these few days, if you have used RAT kits to get tested and is positive, they can still give us the information using the platform to be launched. We will recognize that case. For isolation period, whether it is PCR or RAT, day 0 is the day when the sample is taken. The gentleman over there. From cable TV, I have questions for you. First, about the cases. You talk about a 37-year-old male who is chronically ill. He was sent to Kwong Wai Hospital A&E. He said he was discharged only to be readmitted again. How come he was discharged? Why was there such a decision? Based on what? You also mentioned about after changing the criteria, samples, preliminary positive cases sent to you by private laboratories was instantly turned into confirmed cases. Can you give us the latest figure? And I'd like to also ask about public mortuaries. We've spoken to the trade. They said there are some funeral parlors don't accept certain bookings of funeral halls. That's why even when someone wants to have the funeral, they won't be able to do so. How can you make sure that the whole process is expedited so that bodies will not be stored where they should not been in the first place? And in relation to the end of isolation criteria, you said that negative test on the 6th and the 7th day, then the isolation order is lifted. If my family member is confirmed, I am the close contact and I will have to stay at home for isolation, or I have to stay at home for quarantine. But what about what about the case when I have a negative test, whereas my family member has not obtained a negative test yet. Does it mean that I can go out when they can't? Do I have to wait for the confirmed case of my family member to be tested negative before we can all allow to go out? I would like to first talk about the case with a 37-year-old male. It's someone who is chronically ill staying at a care home. He's in need of long-term care, so the physical condition is rather frail. He was discharged on the 25th. At that time, his condition was stable. And we follow the discharge criteria. So an assessment has already been made before he was discharged. That's the situation. About confirmation of cases and the change of criteria, previously there were about 34,000 cases, and these cases were reported to us as preliminary positive cases. They mainly came from private labs. On the day when the criteria were changed, we turned them all into confirmed cases and entered the information according to the date when the reports were made. They scatter over a week. In the past few weeks, you could see an addition of thousands of cases every day. So the information has been updated. So the daily confirmed cases on the website includes 34,000 cases. The reporter asked about the criteria for completion of isolation. Let me make it clear. First, about the case itself, the confirmed case itself. If that person has to stay at home, and if that person has been double vaccinated, day 0 is the day when the sample is taken. On the 6th and the 7th day, RAT tests have to be done. If they are negative, that means that there is a very low viral load. And of course, if there is no symptom, that person can continue to go on with their lives. But they have to wear a mask if that person goes to work, and will have to stay socially distanced from their colleagues and should refrain from any meal gatherings. And we, of course, advise them to stay at home as far as possible. Next, home contacts. They are not the confirmed case. So day 0 is still the day when the sample is taken by the confirmed case, and family members will have to get tested by RAT on the 6th and 7th day. And if it is negative, and if the confirmed case is negative, then they can all get on with their lives. However, if family members are negative and the confirmed case is still positive, then they should not leave their home. We will clarify that in the isolation order. If of the 2 days, that is the 6th and the 7th day, one of them is positive, then tests can continue to be done on the 8th and the 9th day. As long as there are 2 consecutive negative results, then they are treated as someone who has fully recovered. For family contacts, if the confirmed case itself can leave home, and if the family members have 2 consecutive negative results, then they can leave too. However, if the family member becomes positive, then the family member becomes the confirmed case, and the day 0 will be when the test was done, when the test is done. Is it the case that some funeral parlors are scared of infection by the bodies. That's why they turn bookings away. Sorry, speaker is not coming through properly. The speaker is not using a microphone.
仲有冇其他提問 ？Any other questions? I will answer the last question. I'm from Hong Kong Economic Journal. About the 45 critical cases, what is the age range of these people? Also, there have been 37 more deaths between the 19th and the 25th. Have these people been vaccinated? And also including the 37 male who was from a care home. He was discharged on the 25th and then he died on the 26th. Did you count his death as those on the 25th? And also, you said that he was in a stable condition, so he was discharged. However, he became very much worsened over just one day, and he died. Was it a mistake that he was discharged? And on what day was he confirmed positive? And about the designated clinics, you said that RAT would mean a confirmed case if it is positive. Can these people also go to designated clinics? How can they prove that they have been tested positive? Do they have to take the test kit result with them? And yesterday, 50,000 tested positive cases were wrongly registered with the platform yesterday. What kind of follow-up action there will be? Well, there are 49 people who are in a critical condition, and 37 people died, but then there has been a lag, including 23 male and 14 female. The age range is 37 to 105. As for the 37-year-old male, he was not counted. But and we have given you the figure today because there was a lag. I'd like to say that this person was actually institutionalized. He had chronic illnesses, and he had to be cared for all the time. That is why when he was hospitalized and then when he became better and when the signs of life were all stable, we allowed him to be discharged. But then he was sent to our A&E department on the 26th, and then he died in that afternoon. I do not have information about the other question. I'd like to give the information later. Well, I can give you the information in writing about the critical cases. As for the online platform, well, these people cannot be identified in the other list of confirmed cases, and there are over 50,000 such people. We believe some of them have been tested positive after RAT was done, but then they did not let us know the sample number and other information. So we don't know exactly whether they were tested positive after taking RAT. Therefore, we sent an SMS to these people to remind them that if they were tested positive after RAT, they should treat themselves as confirmed cases. And if the platform will be launched in a few days, we will send SMS to them to let them know that there is such a platform and they should register so that they will have their identity certified, so that in our record we will be able to regard them as confirmed cases. Thank you very much for coming to the press conference today.
我哋接受。我暫時未有呢方面。
Sorry, the reporter is not coming through. We don't have the information. We'll let you know if there is more information.